and they did not credit research being done. They didn't credit any new drugs. They didn't credit, some foundation that found something through fundraising. Guess where the credit went? The credit went to more women saying no to hormone replacement therapy for menopause symptoms. Now, it's been known for many years that supplemental estrogen will cause breast cancer and other reproductive system cancers in women, and yet they continued prescribing it. Kind of looks like maybe they don't have their patients' best interests at heart. Maybe they're prescribing them because their patients demand it, or because that's all they feel that they can prescribe, or even in America, maybe that's all they legally can prescribe, and they want to feel like they're doing something. But why are we using treatments that we know are dangerous? So a lot of women started educating themselves on shows like this, and books, and magazine articles, and interviews, and started educating themselves all about this issue, and finding out about it, and empowering themselves to make a difference in their life and their health. And they started saying, no, Doc, I am not going to take HRT or ERT therapy. I'm not going to take supplemental estrogen. Forget it. It's not worth my life. And because so many women are doing that, breast cancer rates are going down. So if we want to eradicate breast cancer, maybe in addition to educating women on the dangers of bra wearing, we should educate them on the dangers of hormone replacement therapy. This is really radical. Of course, most of the things we talk about on this show are radical because in order to be right in a culture that's usually wrong and running after the wrong things, you kind of have to be a little radical. So that's what we do. That's what we want to do here. So just to consider that. And what else? We have talked about the necessity of vitamin D from the sun, and I think we even spent quite a while on that a couple of shows ago. So I won't spend too much time on that. There's another thing. Several years ago, the American Cancer Society stopped recommending mammograms for all women because it was found that getting a mammogram significantly increases a woman's chance of getting breast cancer, which is what it's supposed to help detect. And it's making it more likely that they'll get it in the first place. Interesting. But that recommendation change did not last long, however, because hundreds of angry radiologists wrote scathing letters to the ACS criticizing their decision because women weren't coming in for their routine mammograms anymore. Interesting. A body makes a recommendation, practitioners lose business, practitioners get ticked off, and the recommending body changes their recommendation. Interesting. There's also been found no link between getting mammograms and an increased survival rate for breast cancer patients. Boy, there's a revelation. The General Accounting Office, which is a branch of the U.S. government, which advises Congress on where they should spend our tax dollars, and among other things, recently recommended that Medicare and other government health care programs stop paying for chemotherapy for certain types of breast cancer. Why? Because it wasn't working. They found that even though it had an effect on tumor size, it had no effect for these certain types of breast cancer on patient survival rates, which is really the whole point of getting treatment, is it not? To increase the chances that you'll survive. And they found that it had no effect on patient survival rates. So the GAO, General Accounting Office, published a report, and I believe it was originally titled Chemotherapy for Breast Cancer, Patients Have Yet to Realize a Benefit. And they got their hands slapped for that one because our government is so thoroughly and securely locked in bed with the pharmaceutical companies. So they said, no, you can't publish that. So they changed the name to Breast Cancer Patient Survival and published the report anyway.